ceramic on highly cross-linked poly. We talk about what are the benefits compared to ceramic on ceramic and compared to metal on poly. We also talk about cost analysis because nothing in India can be discussed unless we discuss the cost implication that is very important in today's world. And then we talk about any drawbacks about this articulation. Now, ceramic on polyethylene bearing works very well and it has got a very long life. And this is a very old paper published in 2001 in JBJ's American. And that time they have mentioned about 17 to 21 year survival of ceramic on ordinary poly. And they had used ceramic stem, Chanley or Mueller-like, which were cemented and combined with 32 millimeter ceramic head and a cemented poly cups. And they have mentioned that there is an outstanding long-term survival and no osteolysis. So there was very low level of wear. They have mentioned 0.03 millimeter per year is a wear rate and volumetric wear was just 28 cubic millimeter per year. And that is quite low. How does the ceramic on poly compare with ceramic on ceramic? And there are a couple of articles. Now this is a randomized control trial meta-analysis, and they have mentioned about 13 randomized control studies of ceramic and ceramic compared to ceramic on poly. They have almost about 2,488 patients in all those studies together. And they have mentioned that when they combine all the studies, they found 15 times higher risk of component-related noises and 6 times higher risk of ceramic fractures in a ceramic on ceramic. Compared to that, osteolysis, loosening, revision rate, deep infection, DVT, etc., all these complications were almost same in both groups. So for survival, now these studies are not going far beyond maybe 8 to 10 years. We don't have any 15 or 20 year survival comparison here, but they haven't found much difference apart from the increased risk of fracture and the noises in ceramic on ceramic. So they favor ceramic on highly cross-linked poly. Another meta-analysis again published recently, and they are analyzed 8 prospective randomized studies, 1,500 patients, 1,700 THA. They found again higher component noises and ceramic fracture in ceramic on ceramic, slightly higher wear in the ceramic on poly, but osteolysis, loosening, revision rate is same in both. So when we talk about comparing ceramic on highly cross-linked poly to ceramic on ceramic, we have to realize that ceramic on ceramic, which is a hard and hard bearing, is very sensitive to the position of the components. If you have some malalignment or malpositioning or edge loading of the ball on a socket, it can lead to catastrophic problem in a ceramic on ceramic, or it can lead to a stripe wear or squeaking and other issues. And that is why it is not a very forgiving articulation compared to ceramic on highly cross-linked poly, where little malalignment will not cause a major catastrophic failure of your implant. How much does the wear debris is required to get an inflammatory response? And this is a very interesting article. If you see the amount of minimum wear debris required to create an inflammation in a tissue, it was 0.1 micron, cubic micron for highly cross-linked poly. Standard poly actually cause less amount of inflammation in the tissue, and it requires 1 cubic micron. Compared to that, ceramic particles are quite inert, and 100 cubic micron are required to create an inflammatory response to the tissues. And based on that, this highly cross-linked poly, there is one drawback that these particles are probably highly or higher than normal poly in terms of inducing inflammation. Again, when you do the cross-linking mechanism in a poly, the poly becomes little stiff, and this stiffer poly compared to the standard poly can easily fracture, and it has got a more production of submicron particle. Now when the poly wears because of the head, either ceramic or metal, these poly particles are of various sizes, but only the particles which are in a submicron zone, that is 0.1 to 0.5 micron diameter, these are the poly particles which are biologically active. And ultra-high molecular polyethylene produce more of such particles compared to the standard polyethylene. So these two factors, that the smaller particles, the biologically active particles, are more in ultra-high density polyethylene, and there are more biologically active. So it is very important that whatever articulating surface which you use on the opposite side should be such that it will reduce the wear of the poly. And that's why it is essential that you should go for ceramic articulation with this than a metal articulation. These are the slides which you must have seen, and they have shown the amount of wear which is produced. And if you see the ceramic on highly cross-linked poly produce a very low amount of wear, and the reason for that is ceramic has got a significant amount of scratch resistance, it has got a resistance to abrasion, and it is a better lubrication. Again, the ceramic doesn't get scratched, and if it gets scratched, the scratch is unlike metal, which is below the surface, so it cannot cause any kind of excessive accelerated wear. So osteolysis threshold is the amount of osteolysis, minimum wear at which the osteolysis can happen. In a ultra-high molecular polyethylene, it is 23 millimeter. If you use a highly cross-linked poly, the wear rate reduced by almost 87%. But in the presence of scratch head or a third body wear particle, this wear can get much more than ultra-high standard poly. And that is again the reason to use a ceramic head, which cannot get scratched and which can produce a lesser amount of wear when articulated with a highly cross-linked poly. How cost effective it is. Now this is just a paper with just now described by Dr. Kurz, and they have studied the Medicare patient between 2010 and 2015, and the cost analysis mentioned that the cost difference between ceramic on ceramic, ceramic on poly and metal on poly is almost less than 1%. But I don't think that paper is very relevant to Indian market, because in India, the implant constitutes almost 50% of the total billing, and a large ball ceramic like Delta Motion can cause almost as much as the total hospital billing, rest of the hospital cost. So we have to be careful about using ceramic because of the cost implication. Only thing is ceramic on highly cross-linked poly or metal on poly, the difference is the ceramic head, which is about 10,000 rupees. And this 10,000 rupees, if you see that these implant may increase the survival in a younger patient, may be beneficial for younger people. But I don't think we should go and run amok and use them for people who are 80 or 85-year-old, because they don't need it for a very long time. So the best articulation for young and active patient with the least complication and the long survival today is probably ceramic on highly cross-linked poly. Thank you.
Great, thank you very much. And up last for this session is going to be Dr. Kurtz again, talking about ceramic bearing and revision total hip replacement.
All right, so now to talk about something completely different. So one of the issues that we've been looking at with ceramic heads when they're used in a revision system is we've been very concerned about the taper corrosion in